I'm Dr. Sanjay Agarwal, one of the skin specialists working in Kothari Medical Center. Today I would like to share with you some of my clinical experience, especially dealing with skin problems in young people. They are they come with special problems which are not seen in other age groups. The first problem I think that most youngsters face is when the puberty starts and then they have something called pimples. It can be a minor problem or it can be a real major problem. And we do see people with very severe pimples, with scarring, boils, with a lot of facial pigmentation, and we have to deal with them. I would like to share two special circumstances where these pimples can be really a problem and normal face washes or home remedies will not work, and they must then go and see a dermatologist. As you know, most of the pimples are self-limiting and can be treated with local remedies like multani mitti or face washes or even cucumber and lime preparations. However, if you have PCOD, which is something called ovarian cysts, especially in women, then it can be a real problem and you must see a skin specialist together with a gynecologist to sort this problem out. Otherwise, it can lead to permanent skin changes and damage. This is one of the main things that we see, and we must warn our people, friends and patients that they must see a special skin specialist and a gynecologist for problem related to PCOD and acne. The other problem we face is that sometimes we have patients who have used fairness creams. These fairness creams can cause a lot of problem, especially when they are being used with steroids. And these steroids can then lead to a big problem with facial acne, skin changes and wrinkling. And I warn many people not to use fairness creams which are available from the pharmacy or over the counter. So this is very important. Two main clinical scenarios where we must warn our patients: if you have PCOD and if you're using fairness creams, then you must see a doctor. The next problem I would like to discuss is pigmentation. Nowadays, all young people have to work. They go to offices, they go to outdoor areas, and then they get severe sunburn and tanning. One of the major armamentarium, or you can say the major way of stopping these problems, is to use sunscreen. However, I see in my practice that many times these sunscreens are not used in a proper way. They're used either too little or inappropriately. For example, you use it very small amounts and that will not help. So I always tell my patients to use sunscreen in a proper way. Take about a pea-sized amount and smear it all over the face. Sometimes you sweat a lot or you have washed your face, you must reapply your sunscreen. Otherwise, it will not be effective. So this is my major take on pigmentation. You must use a good sunscreen and you must be able to reapply if there is a problem. The third point I would like to touch upon is hair problems. A lot of patients come with hair fall or reduction in scalp hair, which is a major source of cosmetic embarrassment to my patients. One of the main causes I would like to highlight in this talk today is basically hair fall due to blood loss, and this is a major cause of iron deficiency hair loss. And we must say that in women, if you give iron, most of these cases will get better very soon. One of the major things in men folk is male pattern hair loss, and this can be a big problem, and we have to be dealt with in terms of treatment with topical minoxidil solutions, sometimes even tablets, and very rarely, in very rare circumstances, hair transplantation. These are the three things I would like to discuss today, and I hope some of these points are helpful to my readers and viewers. Thank you.